Welcome. It is truly a genuine pleasure to have you here with us today.
It really is. Thank you so much for joining us.
Yeah, we are going to take things nice and slow today. We're going to thoroughly explore a fascinating, just a really foundational shift in our understanding of human metabolism.
A completely new way of looking at it, yeah.
Exactly. So I want you to just relax, settle in. We're not going to rush through this. We are going to take our time and really unpack this complex, but honestly, incredibly hopeful topic together.
Deliberately and carefully. There is a lot to digest, but it's worth taking the time.
It really is. So let me ask you, and I mean you listening, when you picture type 2 diabetes, what is the very first thing that comes to mind?
I think for almost everyone, it's weight.
Right. Obesity. We are taught over and over that those two conditions are just, inextricably linked.
Like they're basically one and the same problem.
Yeah, exactly. But globally, a staggering 10 to 20% of people living with type 2 diabetes are completely lean.
Which is just a massive amount of people when you look at global populations.
Right. Up to 20%. They have no excess adipose tissue, no excess fat driving their insulin resistance. So it brings up this huge question, what exactly is jamming their cells?
It's the big mystery, right? Because that 20% statistic, it just fundamentally disrupts the whole established metabolic narrative.
It totally rewrites the rule book. And the answer, as we're going to see today, lies in this hidden battle within the immune system.
Yes. Systemic inflammation.
Right. And today we're going to meticulously examine how a very familiar supplement, omega-3 fish oil, might actually hold the power to completely reshape that immune response.
Yeah, it's fascinating because, for decades, the focus in medicine has been almost entirely on adipose tissue, fat cells.
Because fat cells aren't just storage, right? They actually do things.
Exactly. In individuals with obesity, those enlarged fat cells, they don't just sit there passively storing energy. They actually become these highly active endocrine organs.
Wow, an organ. That's a crazy way to think about it.
Right. And they constantly secrete these pro-inflammatory cytokines. And those cytokines flood the systemic circulation and they actively disrupt the insulin signaling pathways.
So the fat itself is creating the interference. I kind of think of it like a plumbing issue.
A plumbing issue, yeah, that's a good way to put it.
Where the excess fat tissue is just clogging up the works. The insulin is trying to move the glucose from the blood into the cells, but the pipes are blocked by this inflammatory debris.
Exactly. But when you remove the enlarged adipose tissue from the equation, like in our lean individuals, you have to look for an entirely different driver of that blockage.
Because if there's no massive fat depot acting as a cytokine factory, the inflammation has to be coming from somewhere else.
Right.
The resistance is still happening, the insulin receptors are still jammed up, but the culprit is totally different.
Precisely. So in lean individuals with type 2 diabetes, what we are observing is this generalized systemic inflammation.
Everywhere in the body.
Exactly. It's an immune dysregulation that is heavily untethered from their actual body weight.
So how does that even start? How does someone without excess fat develop this systemic inflammation in the first place?
Well, there is some incredibly illuminating research on this, particularly this careful, methodical work coming out of Brazil.
Okay, what did they find?
They pinpointed just how early this immune dysfunction actually begins. We were talking about a breakdown in natural anti-inflammatory defenses that happens, well, it predates the actual onset of the disease by a huge margin.
Wait, really? How early are we talking? Like childhood?
Even earlier in their animal models, the researchers examined these newly weaned animal pups that were just 21 days old.
Wow, just 3 weeks old.
Right. And they looked directly at their lymph nodes, which are kind of the primary staging grounds for the immune system.
The command centers, yeah.
And even at that super early stage, completely absent of any diabetic symptoms whatsoever, the cellular architecture was already altering.
In a 3-week-old pup. That is wild.
Yeah. The specific cell populations that are responsible for keeping systemic inflammation in check, they were already diminished.
Oh, wow.
So the biological environment was basically pre-primed for chronic inflammation.
That suggests that this systemic inflammation isn't just a byproduct of lifestyle, right? Or some environmental stressor that builds up over decades.
No, not at all.
It implies a genetic predisposition.
Yeah.
A baseline biology that just defaults to an inflammatory state.
Genetics undoubtedly play a massive role in pre-programming that immune response. But, what's really interesting is how they are tracking how that genetic predisposition interacts with the body's internal environment.
Okay, what do you mean by internal environment?
Specifically, they were looking at delayed intestinal transit.
Delayed transit. So meaning slower gut motility, like food moving slower through the digestive tract.
Exactly.
How does the physical speed of digestion trigger a whole body immune response? Let's unpack that slowly because that sounds like quite a leap.
It does, but if we take a step back and think about the gut microbiome, it makes sense. Slower intestinal transit actually alters the local environment in the gut.
Because the food is just sitting there longer.
Right. Food stays in the digestive tract longer, which shifts the bacterial populations and their metabolic byproducts.
Okay. The bacteria get too much time to ferment or process things.
Exactly. And this delayed transit can actually increase intestinal permeability.
Leaky gut.
Yes. When the mucosal barrier of the gut becomes compromised, endotoxins, things like lipopolysaccharides, they can slip through the barrier and get into the systemic circulation.
Oh, I see. So these bacterial toxins are leaking into the bloodstream.
Right. And the immune system immediately detects these endotoxins
Mhm.
and mounts this low-grade, constant inflammatory response.
Because it thinks there's an infection.
Exactly. The entire system goes on high alert and it starts generating those cytokines we talked about earlier. And those are the exact same cytokines that eventually block the insulin receptors in the liver and skeletal muscle.
So it's a cascading failure. Slower gut motility alters the microbiome, then the gut barrier weakens, endotoxins leak out, and the immune system just freaks out.
Yes, it responds with this systemic cytokine storm.
And that storm inadvertently causes insulin resistance. So the lock on the cell is still jammed, but the process jamming it is completely different than in obesity.
Exactly. The physiological endpoint, which is high blood glucose, is exactly the same.
Hmm.
But the etiology, the root cause, is entirely distinct.
Which means, logically treating a lean diabetic patient the exact same way you treat an obese diabetic patient is inherently flawed.
It is. If you're just focusing on weight loss, you're missing the actual driver of the disease for that specific person.
Right. If systemic inflammation is the primary driver here, then traditional interventions that just focus on losing fat or just sweeping glucose out of the blood, they're missing the mark.
We need an intervention that targets the immune system directly.
Yes. And that naturally leads us to the intervention that was tested in this Brazilian study. Omega-3 fish oil.
Yes, the fish oil.
But before we get to the amazing results, I really want to look closely at the methodology. Let's take our time with this. The researchers used Gotopackizaki rats, or GK rats.
Right.
If the ultimate goal is helping humans, why isolate the research to this highly specific genetic lineage of rat? Why not use regular rats? Or just jump straight to early human trials?
That's a great question. Jumping straight into human trials for complex metabolic and immune interactions is, well, it's often premature because the variables are just too chaotic.
Right. Humans are messy.
Very messy. You have different diets, different baseline genetics, varying stress levels, different environmental exposures.
And can't isolate anything.
Exactly. But Goto-Kakizaki rats, they are unique. They are actually the gold standard model for studying non-obese type 2 diabetes
Why is that?
because they spontaneously developed the disease without ever becoming obese.
Oh, wow. So they perfectly mirror that 20% of the human population.
Precisely. Their pathophysiology is a perfect proxy. So by using the GK model, the researchers can completely control the environment and isolate the exact biological mechanisms of the fish oil intervention.
Okay, that makes total sense. It gives them a pristine canvas to really observe the immune response without any static.
Right.
So let's look at the actual parameters of the intervention. They didn't just give the rats, like, a casual squeeze of fish oil on their food,
Yeah,
right?
no. It was highly controlled.
They administered a very specific dose. It was 2 grams per kilogram of body weight, and it was specifically formulated with 540 milligrams per gram of EPA and 100 milligrams per gram of DHA.
Yes.
And they gave this 3 times a week for 8 weeks.
And the specificity of that EPA to DHA ratio is vital. Those two fatty acids, they actually interact with their cellular membranes differently.
Okay.
And over that 8-week period, the physiological transformation in these rats was just undeniable.
What happened?
The rats receiving the omega-3 intervention exhibited a marked decrease in insulin resistance.
So their cells started accepting insulin again.
Right. Their glucose control stabilized significantly, but the systemic effects extended even further. Their lipid profiles dramatically improved.
Wow.
Total cholesterol plummeted, LDL, the bad cholesterol levels dropped, and triglycerides were significantly reduced.
Lowering LDL and triglycerides is kind of the expected outcome of omega-3 supplementation, right? We hear that all the time.
True.
But the stabilization of blood sugar in a non-obese model, that is where the real intrigue is for me. We have the physical outcome, improved biomarkers across the board.
The results were fantastic.
But I want to drill down into the cellular bridge. Let's really explore thoroughly how exactly this specific lipid intervention alters an established autoimmune response.
Yeah, let's get into the micro level.
Because we often hear omega-3s described colloquially as cardiovascular janitors, like they are just physically sweeping out arterial buildup.
Right, like scrubbing the pipes clean.
Yeah. But based on the systemic inflammation we're talking about, it seems like the omega-3s are functioning less like janitors sweeping up debris and more like, I don't know, highly skilled diplomats negotiating a peace treaty within the immune system itself.
I love that. The diplomat analogy is actually spot on. The researchers identified what they termed an immune shift.
An immune shift.
Yes. The fish oil wasn't just clearing debris, it was actively reprogramming cellular behavior.
Reprogramming the cells.
Right. To understand this, we really need to look at lymphocytes, specifically Th1 and Th17 cells in macrophages.
Okay, let's take those one by one.
So in the untreated diabetic GK rats, these cells were locked in a highly aggressive pro-inflammatory posture.
Right. So Th1 and Th17 cells, they are essentially the attack dogs of the adaptive immune system.
That's a great way to put it.
They produce cytokines like interferon gamma and interleukin-17, which are highly effective at neutralizing actual pathogens, but they are incredibly destructive when they are just unleashed on the body's own metabolic pathways.
Precisely. They were creating this unrelenting cytokine storm. But the omega-3 intervention actively downregulated the polarization of these Th1 and Th17 cells.
It calmed them down.
Yes, it biochemically instructed the attack dogs to stand down. And that significantly reduced the production of those insulin-jamming cytokines.
Okay, wait, let me pause you there. If we are aggressively suppressing Th1 and Th17 cells, these attack dogs, aren't we just inducing a state of immunosuppression?
It sounds like it, right?
Yeah. Doesn't shutting down the attack dogs leave the person or the rat highly vulnerable to actual external infections, like a cold or a virus?
That is the absolute brilliance of this immune shift. It is not broad immunosuppression at all. It is a sophisticated recalibration.
Recalibration.
All right.
So.
While the omega-3s were downregulating the aggressive Th1 and Th17 cells, they were simultaneously driving up the percentage of TREGs, or regulatory T cells.
Oh, TREGs. Okay.
Yes, TREGs are the immune system's peacekeepers. Their primary function is to restore tolerance and prevent autoimmunity by inhibiting those overactive effector cells.
So it's a dual action mechanism. It doesn't just cut the power to the pro-inflammatory cells. It actively boosts the cellular population dedicated to maintaining systemic homeostasis. Peace.
Exactly. By shifting the balance away from Th1 and Th17 dominance and moving it toward TREG dominance, the systemic inflammation resolved.
That is amazing.
The biological pathways for insulin signaling in the liver and the skeletal muscle were unblocked, and that allowed glucose to enter the cells efficiently again.
So it was entirely a resolution of a cellular conflict, not a modification of adipose tissue at all.
Not at all. The fat had nothing to do with it.
The elegance of that biological mechanism is just staggering to me. It completely validates the necessity of investigating the root cause of the disease rather than just, treating the symptom of high blood sugar.
It really highlights how interconnected the systems are.
But, while reversing the pathophysiology in GK rats is a massive scientific milestone, translating a highly controlled animal model to human metabolic health is notoriously difficult.
Very difficult.
Because, as we said, human biology is infinitely more chaotic. So are we seeing this targeted immune shift replicate in human trials yet?
We are, actually. And the data is highly, highly encouraging. Human clinical research is rapidly catching up to these preclinical findings.
Oh, really? Tell me about that.
Let's look at a 2025 double-blind, randomized controlled trial, which is, the absolute highest standard of clinical evidence.
The gold standard.
Right. This trial tracked healthy middle-aged and older adults over a 12-week period.
Okay, wait, so they were healthy adults.
Yeah.
They were looking for preventive metabolic markers, not just disease management in people who already had diabetes.
Correct. It was preventative. And the researchers found that targeted fish oil supplementation led to a dose-dependent increase in systemic EPA and DHA levels.
Okay.
But more critically, those higher omega-3 indices correlated directly with significant decreases in fasting insulin and marked improvements in their HOMA-IR scores.
Ah, Okay, let's define that for everyone. A drop in the HOMA-IR score means their baseline insulin sensitivity was actively improving.
Yes.
The human subjects were requiring less endogenous insulin to maintain their normal blood sugar levels.
Exactly. It proves that the immune shift is totally viable in a human model. And furthermore, there was a 2024 analysis that utilized modeling data from 161 patients who were actually diagnosed with type 2 diabetes.
Okay, so this is in the actual diabetic population.
Right. And that analysis demonstrated a clear, statistically significant link between higher systemic omega-3 levels and improved HbA1c control.
Wow. So we have evidence of both improved acute insulin sensitivity in healthy people and better long-term glycemic control in diabetic patients.
Yes, exactly.
As a powerful one-two punch. But I want to deliberately slow down here and critically evaluate the limitations.
We always have to do that.
Because it is incredibly easy to look at a successful RCT and assume high-dose omega-3 is just a universal panacea.
Oh, absolutely.
Like, people might hear this and just run out to buy gallons of fish oil. But the leap from controlled human trials to widespread clinical application, it's fraught with variables, right?
It is, and we really must approach the human data with rigorous scientific skepticism. Omega-3s are not, by any means, a substitute for standard metabolic care.
Right. Don't throw away your medication.
Please don't. The human evidence, while very promising, remains quite mixed in broader epidemiological studies. We have to consider factors like baseline inflammatory status, dietary interference, and the bioavailability of different fish oil formulations.
Right, because not all supplements are created equal, and we still haven't established the optimal therapeutic threshold for humans.
Exactly.
A 2 gram per kilogram dose in a rat does not scale linearly to a human being.
That would be a massive amount of fish oil.
Right. Finding the exact clinical ratio of EPA to DHA that triggers that optimal TREG response without causing, say, lipid peroxidation or bleeding risks, that requires massive longitudinal human trials.
Precisely. The puzzle is coming together. But we do not have all the pieces just yet.
Right.
The Brazilian study provided the precise biological mechanism, the why, and the recent human trials confirm that the pathway absolutely exists in our species. But tailoring the intervention to the individual patient's genetic and inflammatory profile, that is the next great hurdle.
It is a really critical distinction to make that this research is a monumental step forward, but it is a step, not the finish line.
Well said.
As we conclude our conversation today, I just want to take a moment to synthesize the sheer magnitude of this paradigm shift.
It's big.
We began by completely dismantling the assumption that type 2 diabetes is strictly an adipose-driven pathology.
Right.
For millions of people globally, it is an autoimmune dysregulation. It's deeply rooted in systemic inflammation that can originate from something as seemingly disconnected as delayed intestinal motility.
Slower digestion causing diabetes. It's wild. We examined how that systemic inflammation, entirely independent of obesity, aggressively disrupts the insulin receptors. And we traced the biological diplomacy of omega-3 fatty acids. We watched them downregulate those aggressive lymphocytes and elevate the regulatory T cells to just restore metabolic harmony.
It really underscores the absolute necessity of precision medicine, moving away from a monolithic one-size-fits-all view of metabolic disease opens the door to highly individualized treatment.
Treatments that target the root cause.
Exactly. Interventions that target the root cause of the dysfunction, rather than simply managing the biochemical fallout of high blood sugar.
It highlights the profound interconnectedness of our biological systems. The immune system, the gut microbiome, and our metabolic pathways, they are not isolated silos.
No, not
They're part of a continuous dynamic feedback loop.
It really is an astonishing web of biological communication. And as we leave you today, we want to offer a provocative thought for you to carry forward and maybe ponder on your own.
Yeah, something to chew on.
If systemic low-grade inflammation can silently drive severe insulin resistance without any visible indicators of obesity whatsoever, what other pervasive metabolic conditions or modern chronic diseases might actually be hidden immune system imbalances?
Just waiting for the right nutritional key to be discovered.
Exactly.
It is a question that really forces us to reevaluate the very nature of chronic disease, and it opens up entirely new frontiers in metabolic healing.
It certainly does. Well, we want to thank you deeply for choosing to spend your time with us today.
Yes, thank you so much for being here.
Thank you for joining us on this careful, unhurried examination of such a complex and ultimately hopeful topic. We genuinely wish you a wonderful, peaceful, and absolutely healthy day ahead. Please stay curious and take excellent care of yourselves.